Friends, good evening, and it's nice to see a full robing room, so you're all welcome here tonight. And I can see members of both houses, ministers, distinguished academics, doctors, members of the press and parliamentary staff. Last summer, Sir Charles Walker and Alistair Campbell gave a lecture in this room about the urgency of addressing mental health in this country. They were right to do so. Alistair and Sir Charles showed us how heavily stress and mental health issues can weigh even those in most central parts of public life. This is now a major political issue with huge ramifications for us all in society. But the problem is much wider. Our ever-connected world has created pockets of isolation where people are detached from society, and social media use has modified our behaviour and our discourse. The mental health challenges, particularly for young people, are only increasing. Loneliness affects every age group and in a manner which is hugely damaging. We need to look at this not from our own limited perspectives, but with complete awareness of the global picture. In reflection of this, we tonight welcome a physician whose skills and experience reflect this need. After all, Dr. Murthy, whom we welcome here, has served as Surgeon General under multiple US presidents, building upon an already impressive CV as a doctor. Among his achievements in office, he can point to his management of the Ebola and Zika viruses, the opioid crisis, and his work on preventing the harmful effects of stress and loneliness. And to this day, he continues to fight health misinformation, the ongoing youth mental health crisis, and the high levels of burnout among healthcare workers. This is a significant record, and if that was not enough, on his appointment, Vice Admiral Murthy became the youngest admiral serving in the US uniformed services. Should this global reputation be in doubt, I will mention that Dr. Murthy is the son of Indian immigrants who was born in, believe it or not, Huddersfield. I don't know why his parents decided to abandon Yorkshire, but I will say that Miami, where he lived from the age of 3, offers a few days more sunshine. But I hope you feel very welcome back in the UK. Our custom here in the House of Lords is for our guest speakers to be questioned by our own in-house experts in a conversation. Who could be better qualified to do this than Baroness Kidron? Many of us were privileged to see Lady Kidron's forensic examination of the online safety bill when it was before the House of Lords. This was just a continuation of her years-long work to protect children online, which she has achieved through constant work in the House, through charities and through engagement with figures at the heart of government, both here and abroad. Some of you may know of her career in film, working alongside distinguished figures such as Steven Spielberg. But she's equally comfortable being welcomed by presidents at the White House or by the Governor of California, Gavin Newsom, with whom she sought to provide legislative solutions to protect young people online. I am pleased that this event will be filmed and published online, though the Q&A will not be recorded. The House of Lords chamber is still sitting, so if a division occurs, then this will be announced by the doorkeepers. We will continue to keep the event and invite members to return to us after they've cast their votes. So it is now a pleasure to hand over to the US Surgeon General and Baroness Kidron. Thank you.
Well, thank you so much for that welcome, Speaker, and really big welcome to so many colleagues from both ends of the House and from academia and across so many of the spaces that care so passionately about the issues that the Surgeon General is a leader in. I'm going to start by asking you why you made the issue of mental health and loneliness so central to your mandate. You chose to look at the world from that perspective. Why was it?
Well, thank you so much, Baroness Kidron, and Vivek as a friend, and so we're informal, so that's why we often call each other by our first name. And I also just want to thank Lord Speaker also for your hospitality and the kind invitation to all of you for having me here today. Vivek, for me, I actually, if you had asked me when I first started my tenure in public service, what would be on your priority list, I would not have listed loneliness as one of those priorities. I probably would not have even put mental health on that priority list. This is despite the fact that I had my own struggles with mental health growing up and my struggles with loneliness and isolation that I never talked to anyone about because of a real deep sense of shame that I carried with me. And it was despite the fact that as a doctor, I had cared for many patients who struggled with their mental health and who were dealing with loneliness. They may have come in for a heart attack or for a bloodstream infection, but in the background, they were often struggling with isolation and loneliness as well. But what really shifted my thinking and brought it onto my agenda were these conversations I began having with people all across America. You see, when I began my tenure in office, I traveled the country and on a listening tour, asking people, how can I be helpful? And then trying my best to just sit back and listen. And a lot of stories came up, but very commonly, the stories that were shared were stories of isolation and loneliness. And you know, that word lonely is a funny word. It's a word that can feel stigmatizing, it can feel a bit shameful, maybe even a bit embarrassing to talk about. And so people never came to me and said, hi, I'm Vivek, I'm lonely. What they said was more nuanced. They would say things like, you know, I have all these people around me in my school and my university, but they don't know me and I don't really know them, and I feel like I can't be myself. And I feel like I'm on my own. I would talk to parents who were shouldering so much and said, I have to shoulder all of that by myself. There's nobody I can share that with. And I just also heard the word invisible come up a lot. People who felt that they were walking through life and that they were forgettable, that if they disappeared tomorrow, something happened to them, no one would care. When I started using the word lonely, I'll tell you, it was like a light bulb was going off in people's eyes. Right? It's the kind of recognition that I have now noticed over time. It comes not from intellectual processing, but from visceral recognition. It's that feeling that says, I felt that before. I've seen that before. And actually, I'm just curious, just by a show of hands, how many of you know someone in your life who may be struggling with loneliness or isolation? Many of us, if not all of us. This is a very common challenge. So that's ultimately what brought it onto my agenda as an issue that required our attention. And as I got into it, I'll tell you what I found was really quite profound, which is that loneliness was in fact common. With 1 in 2 adults struggling with loneliness. The numbers, frankly, were much higher among young people, though. In some places that we've gone to, 80% of the young people at universities are saying that they're struggling with loneliness. But it was also the fact that it was consequential. They had a real impact on our health. And the studies were telling us that those people who struggled with being socially disconnected, their risk of anxiety, depression, and suicide were much higher. Their risk also of physical illness was also higher. And this was actually quite surprising to many people who thought, loneliness, this is just a bad feeling that we have. But the risk of stroke and heart disease, and dementia and premature death all seem to go up. The fact that people seem to remember most from our report on this subject, which we issued last year, was that the mortality impact of loneliness and isolation are similar to the mortality we see with smoking, and even greater than that which we see with obesity and sedentary living. These 3 things, by the way, obesity, sedentary living, and smoking, we think of those as classic public health issues. And now what we've realized is that loneliness and isolation...
Could I interrupt? I'm told the microphones don't work, so here.
None of them.
Yeah, see if this helps.
Is this better?
Yeah,
much better? Okay.
So I'm going to take the opportunity to say, so I read somewhere that you said loneliness was like a hunger, yeah? And
Maybe use
Oh, sorry, me too. I read that you said loneliness was like a hunger, and that it sort of signals, and you're talking about that it signals all sorts of things, but what did you find when you went out as the drivers for that? Are you saying it's a modern malaise, or are you saying that you've identified something that's been around an awful long time?
Well, that's a really important question, and I do actually liken loneliness to hunger or thirst, because it's a feeling that our body produces when we're lacking something we need for survival. And if we meet that need with food and water, in the case of hunger and thirst, or with social connection, then that feeling may subside. But the challenge comes when the feeling is prolonged. And so just like starvation and dehydration can be life-threatening, so too can chronic or deep loneliness. The drivers, what's interesting about loneliness is I call it a natural human feeling, though, because people have felt lonely for millennia. But there is something different that's happening now. And I would say even as recently as 40, 50 years ago, there were forces that brought us together by default. Right? At a time when people didn't move around as much, when they didn't graduate and go off to university in a different town and move jobs every few years, at a time when people participated in faith organizations and recreational leagues and volunteer and service organizations at a high level, at a time where people also didn't have sort of the efficiencies of modern day America, where they had to go to the store to buy a product, had to go to the grocery store to get their food. They would run into other people. They would see each other. But a lot of that has changed now. Like, we don't have to go out and interact with people as much. We move around a lot more. Our participation in all of these entities that I mentioned, faith organizations, rec leagues, service organizations, in the United States at least, that participation has declined steadily over the last half century. But I do think, finally, we can't lose sight of the role that technology has played. The technology, which was supposed to be the great connector, and somehow has become the great divider. That which was supposed to bring us together has somehow, ironically, diluted our relationships and pulled us apart, and created space and room for vitriol and for toxic dialogue that I worry is contributing to our polarization today. Now, that we may recognize it in our lives, perhaps, and see in our own experience that has been challenging, but I urge you to think for a moment about a young person who's grown up as a digital native for a moment, who's living through this, who sees this as the norm, who doesn't necessarily see an alternative to living your social life online, on social media. And what I worry about most is that for no fault of their own, young people have been having this experience on social media, which I worry has negatively impacted them in many ways. It's not to say that there aren't some benefits that young people get from social media. Sometimes social media can be a way for them to express themselves creatively, find a community that may not necessarily be present in person. But with anything, you have to look at the benefits and the harms. There are literally medicines that we have pulled off of the market because despite their benefits, the harms are just too excessive to tolerate. Here too, what we have seen is that young people tell us all the time that the negative impact of social media on their self-esteem is quite staggering. They often say, I go on social media and I feel worse about myself because I'm constantly comparing myself to other people. By the way, adults say that too. So this is a real challenge for young people.
Vivek, will you explain what the function of a Surgeon General's advisory is and why you did one on social media, mental health of youth? Because that's how I came across your work. And it was a singular voice in the American context that really took a stand on these issues that we've been discussing here. And I think it's quite different in America, what the role you have. So maybe you could explain what the advisory means and how you came to do it.
Sure. Well, thanks, Vivian. And I should just give some broader context. In the United States, the role of the Surgeon General is to look out for the public health of the country, and specifically to function in a way, what's informally called as the nation's doctor, which means in the same way a doctor, your doctor, would seek to give you advice based on the best possible science and best possible judgment about what to do for your health, just as a doctor might call out threats for you and say, hey, this is some cautions you should take to protect yourself and your family. That is the role of the Surgeon General for the country more broadly. One of the things we do is we produce reports and advisories, physical documents on issues that are critical public health importance. The reason I chose to do one on social media and youth mental health was because the most common question I was getting from parents was about social media. The most common question, and it wasn't even close. And the question they had is this really safe for my kids? And the reason they were asking that is because they were watching what was happening to their kids. They were watching the shredding of self-esteem. They were watching their kids spend more and more time online and then turn into different people when they tried to take the device away. They were watching what happened to their in-person relationships, the dwindling of those over time, and they were worried. And they wanted to know, is this safe? So that's why we actually put our report together. And just two conclusions that I would say amongst a raft of data and a recognition that there's a lot more data that's needed. Some of the folks in this room have been very thoughtful in helping to build that evidence base, like Andrew and Amy and others, and I'm grateful to them. But they know better than anyone else that we got a lot more research that we have to do, questions we have to answer, gaps we have to fill. But here's what I also knew, is that one of the differences between sort of being a doctor and being in a pure, I would say, public health role, to bridge both, you have to be able to deal with emergencies when they arise and to bring the best of your data and the best of your judgment to the table, right? If I had a patient, for example, who came into the hospital and was literally having a code, a cardiac arrest, and I said, well, why don't we wait 5 years until a few more clinical trials are done, and then we'll see what I'm comfortable prescribing for you. Like that wouldn't be a good approach, let's just say. It's likely I would lose my license, and I should. But in this case, what I would do is say, well, what does the best possible evidence tell us? Well, how can we combine that with our best judgment and then bring that together to make recommendations for you? Because right now you are having an emergency. And this is a situation we find ourselves in with social media. And that is why I think that while we continue to work on filling the evidence base, what has concerned me is all of the stories, number one, we're seeing right in front of our faces that are where young people themselves are telling us everywhere I go in the country that they are struggling with social media and how it's making them feel. 50% of adolescents in America are saying that using social media makes them feel worse about their body image. A third are spending until midnight or later on their devices, on weeknights, on school nights, and a lot of that is, we know, ultimately social media use. There are real concerning data points that tell us something is going on. And so you could take one or two approaches to this, and I'll tell you the approach we took. You could either say, let's keep waiting until we have more information, or let's take a safety-first approach, which is to say, let's make sure these are safe. If we don't have the data that they're safe, let's put in place some measures to make sure that we guide parents, guide young people, and ultimately guide platforms to make sure that these experiences aren't as harmful for kids as they currently are right now. And that's the approach we took. And that's why we put forth recommendations combining data and judgment. I do think, Biban, that if we look back in history, in 5 years, in 10 years, that we will look back on this moment and say, this technology has been around for nearly 2 decades, for 20 years. We will say that parents in many of our countries were raising concerns about this, that kids themselves, who have remarkable insight, by the way, on how social media impacts them, were also raising concerns about this. And yet we waited, and we waited, and we waited. And I just do not think that that will be defensible in 5 years. I don't think it's defensible now. And that's why we have to take action.
I really commend you for saying that, but I'm going to double down on my question and say that some here, we've had quite a lot of criticism of our regulators for not being bold. We've had criticism sometimes of the government for not being bold. And I know that just this, in the last week, the US National Academy has come in for quite a lot of criticism for its report that says the science says there is no problem. We need more data. I mean, how strongly do you feel that the institutions of government and even academia need to take some sort of best guess stand or some sort of way of articulating what might be coming ahead? You know, I really think put it this way, when you published your advisory, the world lit up. we did not have someone with your authority saying that level of watch out, we have a problem here. So I'd really be interested if you'd say what you think the institutions should do. Sure,
and look, to be fair about this, those who raised the points about the open questions that we still need research for, there's nothing wrong with that. It's absolutely right. You know, we need those voices out there because we need to fill those data gaps. But I also don't think that we can stand still in the face of an emergency. We have to use our best judgment and best data. We have to take action. And I think that to say there's no problem here, I think ignores the reality that's in front of our faces, right? If there truly is no problem, why are literally thousands and thousands of students all across America telling us that they're feeling harmed by this? Why are university administrators saying the same? Why are parents echoing the same? Why on survey after survey after survey are students literally telling us, they are telling us, that they are feeling worse about themselves because of their use of social media? Why are we seeing leaked data from the platforms themselves that point to harms that were concealed? Like, even if you say, well, all of that is circumstantial, maybe there's other evidence, it comes down to a fundamental question of, is this about a safety-first approach or not? Like, you know what we don't do? I'll tell you what we don't do in the UK, the US, or anywhere in the world. We don't tell a company, you know what, why don't you just make baby food, do your best, put it out there, and if a lot of people die, then maybe we'll look into it. We don't do that. We say, when it comes to our children, our babies, we care, so we want to make sure that that food is safe before you put it out, right? Similarly with cars, we were in a circumstance several decades ago when motor vehicle accident-related deaths were quite high. This is when I was growing up, this was the case. And we didn't say, there too, you know what, maybe this is just a price of modernity. Maybe this is just the price of technology. We don't want to go back to horses. So why don't we just move on with our lives and tolerate these deaths? No, we didn't do that. We said, we can go forward but make these cars safer, right? There was a principle around safety, but what we have done at this point, largely over the last 20 years, is we've left safety up to the companies. We've essentially said, do your best. And you know what? Their best is not good enough. Because I have asked a number of times, show me the evidence, you know, company X, whoever it is, but can you present the evidence to the public, to parents, to independent researchers that tells us that these platforms are actually safe for our kids, that they don't have an adverse effect on their mental health? Can you transparently give us all of your data and demonstrate that? The answer has been no. So if you're a parent, you're right to be worried. You're right to be suspicious. And this is where, as much as we may ask parents to do better, as much as we may put out 10-point plans for kids for what they should look out for, and we should do all those things. User education is important. But we didn't ask parents and kids to go inspect their own cars and make sure the brakes were okay and test the body frame themselves to make sure it would hold up in a crash. We didn't ask them to go test their own baby formula to make sure it wouldn't hurt their kids. We said, this is a place where, as a society, we need to step in and make these products safer so that kids and parents will be better off. And that's what we've got to do here, too.
So earlier we were talking about AI and the tectonic plates moving. And I know there's a number of people in the room who work specifically on AI. So maybe you could tell us what you worry about or what you see, or what are you thinking about this moment?
Well, I just want to say, like, I know with us today we have many members, you know, of the House of Lords and the House of Commons, and I first just want to say this is a very, not just in the UK, but I know around the world, this is a really tough time to be in government, to be a legislator, to be a lawmaker. There are a lot of issues I know that are before you, urgent issues. Everything is demanding your attention, and a lot of times public opinion can often be unforgiving, right? And you're subject to a lot of blame, no matter what stand that you take. And in that kind of environment, I worry about that environment, frankly, because we need to attract good people to public service. And the fact that all of you are still here, that you're still fighting to make better, stronger laws that can make society better and stronger, is really a credit to you. And so I just want to express my gratitude to you for that. Because one of the threats that we are having to contend with, that's coming around the corner, and frankly it's already here, but it's continuing to emerge from around the corner, is AI, right? And that's a place where in some ways we can't afford to take the same approach as what we did with social media, to wait 2 decades and then to consider taking action. This is a place where I think hopefully we can use the benefits of hindsight with social media and say, aha, maybe this is a place where we can focus on safety first. Maybe we can do that early. Maybe we can bring the public into it. Maybe we can focus on the safety of kids. Because I do worry about our kids in particular, and already about the digital environment they're growing up in, but also about the question of how AI is going to impact that. Now, the last thing I should say about this is I don't think that any calls for safety should be interpreted as anti-technology. I think that's really important. You know, I'm a believer in technology. I spent 7 years building a technology company myself before I was Surgeon General, alongside my career in medicine. Like, I'm a believer in the power of technology to make our lives better. But whether it does or not is fundamentally dependent on how it's designed and how we use it. And that design has to be shaped in a way that ultimately protects our safety while also advancing, you know, utility and advancing the benefits. And I think with AI, we're in a world where it is growing so rapidly. Like, we can't wait 20 years, because in 20 years, AI will be much farther along than where social media got in 20 years. You know, every day it feels like we hear more advances about this. So I do think, Vivan, that this is a space where I'm hopeful that thoughtful lawmakers can come together, help us learn from the lessons from social media, and build the foundation for safety while engaging the public that we really need urgently.
I am keen to open this up in a moment. So my last question to you is, I know you went on a tour of America talking to young people, and I want to know what the young people said that the grown-ups didn't.
Well, that's a great question. I'll tell you, there's really, for me, nothing that I enjoy more than actually being out there doing these roundtables with the public and with young people in particular. And the reason I love it so much is because that's when I learn the most. Because I've just been so impressed everywhere I go at how much young people have to say. And by the way, in the last couple of days I've been here in the UK, I had the privilege of sitting down with young people at the University of College London, at UCL, but also, you know, in the very first day I got here on Sunday, we sat down with a group of young community leaders from actually different parts of the country who talked to us a lot about mental health and what they're doing to help address mental health among their peers. I just think the amount of insights young people have are immense, and the more we can involve them in conversations to inform and shape policy, I think the better off we are. Here's what I learned on this tour. I learned, first of all, that young people have, you know, they are certainly, the polls are right and when they say that young people are deeply worried about the future. That is true. The polls are also right when they say they have a lot of anxiety about climate change. And the polls are also right when they say that young people are struggling with high levels of anxiety and depression. All of that is accurate. But what does not get reflected in these polls is the fact that young people still also have a hunger to make things better. They want to be a part of leading that process of making things better. And some of them are already starting to do it. You know, we've seen student movements crop up in the United States where young people are now helping other young people, their peers, their friends, manage social media so they can benefit more from the good sides but protect themselves from the harms. Here in the UK, I met with a wonderful woman, Holly, a young woman who founded and leads an organization called the Lonely Girls Club, which, if you think about it, given how stigmatized an issue like loneliness can be, it was a pretty bold thing if you're a young person to start a whole public group for young people to come together and admit they're struggling with loneliness. But now she's using that as a bridge to offline connection and bringing people together in person. So, you know, I learned that that fire is still inside young people to make things better. They want to believe that they can be a part of driving that change, but they also need some support. They need, you know, adults around them who can also encourage them, who can bring them into the table, who can recognize what they've done and shine a light on it and help lift that up. And so that ultimately gives me great hope, despite the challenges that we heard from you.
Fantastic. Thank you so much for that. That's wonderful.
It's a huge privilege to have been asked to give this vote of thanks. As the Lord Speaker said, I was Minister for Loneliness during COVID, which was an extraordinary time. to have that job. And I met Dr. Murthy online, bonding over loneliness during COVID, as one did. And you've been so generous, Dr. Murthy, in your thanks to all of us and everyone in the room about leadership on this issue. But you, of course, have our deepest thanks in terms of your leadership on this issue. And many of us in the room are public servants in different ways and policymakers. And I was very struck not just about what you've achieved, but also how you've achieved it. And you started off by talking about listening, and that you started on a listening tour. How many of people want to go on a listening tour? I'm tempted. That's so striking, because listening is exactly the behaviour that gets to the heart of addressing loneliness. People don't feel heard. They felt invisible, as you described it. So I was very struck by that. I was struck by your focus on solutions and your restlessness, even with AI still coming around the corner, as you put it, to make sure, even if we haven't got all the answers, that we get started on trying to address the problems. But most of all, genuinely, I was struck by your courage. It's kind of easier now to talk about loneliness, but I think, and mental health issues, but I think when you started to do it, as you said, this was an issue of tremendous shame, and some of you will know the work of Brené Brown, and she talks about shame as being the thing about you that you kind of feel here, and you don't want anyone else to ever know about it. And that really hidden shame, which is so corrosive to our well-being. And actually, one of the things, and I'm sure, Stuart, you feel the same, having loneliness in your job title gives you permission, gives people permission to talk to you about their loneliness. So there's something about giving it oxygen and bringing it into the open that is healing in and of itself. I think the second thing that struck me in terms of courage is we were all very polite this evening, but I imagine you faced huge opposition from very, very powerful vested interests in terms of your work to try and address the harm of social media, loneliness, and other mental health issues that come with it, particularly on our young people. And then finally, at the risk of stating the obvious, it's a huge problem, and perhaps one of the most serious moments this evening was when you were talking about the 30% of girls in high school who've considered taking their own lives. That's just a terrible, terrible, terrible statistic. But to end, and I was so glad when you came to this in your remarks, because Biban is absolutely right to stress the importance that we've got to get the laws right and we've got to get our institutions right. But actually, I genuinely believed, and when I was minister, and I still believe, that loneliness is one of the things that every single one of us can do something about today, this evening, tomorrow. It's in our gift to address it in a small way. I remember during COVID people saying, well, what can one do? And I said, well, just pick up the phone, ring someone you haven't spoken to for a while and just say, I was thinking of you and I just wanted to hear your voice. There's none of us who don't feel better if we get that call. And you mentioned it more formally in relation to social infrastructure, but you also mentioned it in relation to culture. And some of you will know the story of the young girl on the beach who walks down and she picks up starfish on the beach and she's throwing them back into the sea. And there's a guy walking his dog and he comes up to her and he says, what are you doing? And she said, well, the sun's coming up and the tide's going out and these starfish are going to die if I don't put them back in the sea. And he says, but look at the beach, it's so long and there are so many starfish. And she looks at her hand and she says, but to this one, it makes all the difference. And I think with loneliness, people will say to us, it's such a huge problem. Where do you begin? It's so complicated. But I do think each one of us can make a difference. And just to finish, you described in your culture what you thought the US stood for as, I think I heard right, you said courageous, compassionate, and optimistic, and I think that's what we heard tonight. So thank you.
Thank you, Lord Speaker, and I thank you so much, Baroness, for that incredibly kind vote of thanks. And it has been a true privilege to be here with all of you today. I know that we are in difficult times, as a global community. I know that the challenges we're facing are great. And I know that there's also a lot of pessimism around the world and in our communities that we sense and we probably hear. There are a lot of reasons not to do the jobs you're doing, not to face the challenges you're facing, and the fact that you are here, standing in the center of the arena, taking these on, I mean, that says a lot about you, but it also makes me more hopeful about the future. When I feel worried about the state of the world, when I see the mean-spiritedness grow or the pessimism build and worry about whether this is just the way it's going to be, what I think about often to give me a source of hope are my own children. And I think about them not just because they're my kids and they make me happy, but I think of them because I think children, young children, have something to teach us about our true nature. For those of you who have kids in your life, who have raised kids or been around small kids, you know that their true nature often is there from the get-go. They're curious, they're compassionate, they're expressive, they laugh when things are funny, they cry when things are sad. Some would call that authentic. But they also just have a natural affinity for people. And that reminds me that our true nature is not bad. It's not to be selfish and mean-spirited. Our true nature is to be good. It's to be kind. It's to be decent. It's to be courageous. And that's who we're called to be, once again. And that's why, to me, like, these issues are so much bigger than the issues themselves. This is a conversation we had tonight is about more than loneliness. It's about more than social media. It's about more than mental health. The conversation we had tonight is about who we are, who we choose to be, and the identity we want to build for our communities, for our country, and for the world going forward. Our history tells us that we can do extraordinary things when we not only believe in ourselves, but when we believe in each other. When we stick together, when we build bridges of hope, when we do that courageously and we forge forward in the face of adversity, we can do extraordinary things. Our two countries together have done extraordinary things in history. We have demonstrated that to the world. And I'll leave you with this, with a small exercise that we do with our students on the road and with communities and audiences across America, but it's what I think of as my deep source of hope, that it takes 30 seconds to dip into. And if I'll ask you to do it with me, I'll have all of you just hold up your right hand, okay, and place it over your heart and close your eyes. And for the next 30 seconds, I want you to think about the people in your life who have been there for you during difficult times, people who showed up when things were tough, who believed in you, maybe when you even lost faith in yourself. People who stood by you, not just with their words, but with their presence. The people who celebrated you and who celebrated with you during good times. The people who reminded you of who you are in those moments when you forgot. And feel their love flowing through you, filling you with joy, filling you with strength, and filling you with peace. And know that that love is always there for you because it resides in your heart, even if they are no longer with you. And now open your eyes. What we felt in those 30 seconds, that's the power of human connection. That's the power of love. That's the power of compassion. As a doctor, I've prescribed many medicines over the years. but I've never prescribed anything as powerful as what I've seen love do to help us heal in body, mind, and spirit. And that's a power we all have. We don't need an MD or a nursing degree or any other health degree to be able to help others heal through the power of love and human connection. We just need to be able, as the Baroness said, to pick up the phone and call and check on someone, to show up during a time of great need, just to let people know that we're there for them, that we care about them. In a world where so many people feel invisible and forgotten, that makes a huge difference. That makes all the difference. And so as we set forth, I hope we'll always remember that power that we have. And we'll always remember that the people around us, we may not necessarily see what's happening in their lives, but they may be going through great pain. That pain may manifest as anger, may manifest as being contrarian, it may manifest as in all kinds of negative ways that cause us pain and discomfort. But there's a lot of pain that people carry, and that pain can be healed with the power of compassion that we wield and that we have in our hearts. So that's what I hope we can build together. And so I'm so grateful to all of you for being leaders at a time like this, and to my friend Biban, who has been just such a wonderful partner tonight, but also for months before this, to our Lord Speaker, who was so kind and generous to invite me today, and to all of you, I just offer my deep, deep gratitude. Thank you so much.
What is recognised today is the loss of the art of encounter in society. But Dr. Murthy, you have given us that tonight in this fantastic presentation. And I'd like really to thank you, Beeban and Diana, for your contribution. Now, after this, there's opportunity to have a discussion outside and sample our wine, amongst other things. Now, the House of Lords is considered a very, very posh place. So what I want all of you to do is, if you're taking a glass of wine and you speak to MD in the media outside, say, it was not the finest wine.